Right. So you discuss a lot of benefits of Shivambu when we ingest or drink the
Drinking,
Shivambu,
yes,
like toning the change of skin,
correct.
gut cleaning, and whatnot.
Mm-hmm.
So you talk about the internal ingestion. Is there anything like external Shivambu? And are there any rules for that external Shivambu?
Yes. Now, when we talk about external Shivambu, we are talking about applying to the body parts,
Okay.
whether it's the skin, eyes, ears. So this consists of applying to the skin, washing your eyes,
Okay.
putting drops in the ears and the nose, washing your mouth, and washing private parts, that is sexual and anal area. Now, we'll talk about each one of them in detail.
Right.
So when we talk about applying to the skin, it is highly recommended that the urine must be at least 3 months old to have best therapeutic effect.
Okay.
Okay. There are instances of people using fresh urine and getting some results. But generally those results come only if the issue is a minor problem. If they have a major problem, we generally find age urine helps.
Okay.
Shivambu Kalpavidhi specifically talks about using boiled fresh urine and reduced to 1/4 quantity. And that 1/4 quantity is, I believe, somewhere equivalent to 3 to 5 year old Shivambu
Sure.
aged.
Okay.
Okay. Now, when you apply urine, age urine to the skin, ideally, if you can massage it in, will be ideal. Otherwise, just apply it. Then, preferably wait for 30 to 60 minutes. If possible, sit in the sun,
Okay.
ideally. And then, when you shower with water, do not use soap because soap cuts into the skin. What we recommend is you use split pea flour or besan and milk, and that is better for the skin. It only takes away the Shivambu effect, but it doesn't cut into the natural oils that are coming out of the skin.
Okay.
We definitely don't advise any soaps of any kind because they are too harsh on the skin. People have used fresh urine, as I said, and for some conditions it works, but generally for chronic conditions we have not found it useful at all. Rather, it's useless, and then people come to us and say, "We tried it, nothing happened."
Yes.
Minor, minor problems like dandruff and some minor itchy conditions, or even some insect bites. If you don't have aged urine, you can just use fresh urine and apply it, and you'll find the itchiness and the effects of the insect bite may diminish a lot. Okay. Now coming to the eyes, washing the eyes. Here you can use fresh to 1 week old, or even aged urine. But I will talk about aged urine separately there. You collect the urine, fill it in an eyeglass. I suppose everybody knows that the eyeglass is used to wash the eye.
Yes.
You fill the eyeglass with urine. If it is fresh, it will be warm, so it will be more pleasant to the eye. And then you dip one eye into the eyeglass, and as you dip it in the eyeglass, you slowly try to open and close. Now remember, urine is going to sting. But because it is fresh urine, it is not so concentrated, so it will not sting as much. So slowly try to open and close the eye, and then when you are able to keep your eye open, then under the urine in the eyeglass, keep your eyelids open so that there is direct contact with the urine, with Shivambu and the eyeball.
Right.
And then in that situation, you move the eyeball left, right, half a dozen times, up and down half a dozen times, and then rotate clockwise and anti-clockwise half a dozen times each. The reason for doing that is when Shivambu is in contact, it gets into contact with every aspect of the eyeball as best as you can. Then of course, swap the eye. You don't need to have fresh urine, the same urine can be used. But if you are fussy and you got plenty of urine, you can throw this one out, take fresh and do it again.
Okay.
Generally, we find up to 1 week old urine does not sting as much. Using 3 to 24-month-old stings a fair bit and can feel traumatic for some. Please be careful.
Okay.
It can leave you with reddish eyes and it may look like not very comfortable. Okay. Now, eye washes can help reduce eye strain. It benefits tired eyes. For some vision problems, it can help. Some cataract patients have found it to be very useful and reverse their cataract. I have found conjunctivitis responds very briskly within 24 hours. But please be warned, if you use it for conjunctivitis, whether you wash your eyes with an eyeglass or whether you put a lot of drops, be prepared that your gunk coming out of your eyes will be massively increased over the next 24 hours. Because the eyes are throwing out all the unwanted stuff.
Right.
When you wash your eyes with aged urine, the eyes may become reddish and there may be continuous gunk coming out of both sides of the eyes. Moving on to ears and nose. Ears, I recommend fresh urine to 1 week old only. Place drops in the ears, block the ear for a few minutes and shake it and then empty it. Repeat for the other ear. If you are having a shower, wash with water and then dry it properly afterwards. Otherwise you can get some unwanted fungal infections and stuff like that. If using aged urine, it may sting. After the same procedure, make sure you wash the ear with fresh warm water to ensure no local reaction of aged Shivambu persists inside the ear, and then dry the ears properly. Nose. I recommend only fresh to 1 week old because the nasal mucosa is much more sensitive. I normally suggest you hold the Shivambu in your hand, cup your hands and then draw the Shivambu in through the nose, both nostrils and spit it out through the mouth. This way you will find the sinuses get a good wash. People have used neti pots for that and that's okay too. Please ensure Shivambu when drawn through the nose does not get sucked into the sinuses. Please forcibly breathe out through the nose after this practice for safety. We definitely do not recommend and advise to use aged urine for the nose. Some practitioners have noted benefits and results of aged urine drops in the nostrils for Parkinson's and shaking palsies. Use with care and make sure there is no dramas. Lastly, we come to mouthwash. Use of fresh urine or 1 week old is more than satisfactory. You just take a mouthful, rinse your mouth thoroughly. You may notice that in spite of having brushed your teeth clean and everything else, if there are any food particles stuck between the teeth or in the teeth spaces, that the food particles get released very quickly. I recommend not to use aged urine, 3 months or older. The oral mucosa, which is a very fine, thin mucosal lining, separates and you'll notice that white skin cells are left behind in your whole oral cavity and you're spitting out constantly. This I do not consider very healthy, and my reason is the oral mucosa is a protection for your mouth from other stuff. If you lose that consistently, if you're using aged urine to rinse your mouth once a week and you lose that every week, then when you eat hot or cold foods or whatever or different tastes, you're likely to hurt the mucous membrane of the skin inside the oral cavity. So please don't try that. And if you have any doubts, please contact us. So it's not advised. Sexual area and anus. It is advised to use fresh urine generally. Some ideas are to place a wet pack in the sexual areas, vagina, testis and groin area, or washing the vaginal area, washing the anal area. Please ensure you wash off after an hour to ensure no negative reaction occurs due to Shivambu. You cannot leave it dry with Shivambu for 24 hours and then wonder why your skin is having a reaction. Because two things, the skin in those groin areas is quite sensitive and delicate, and Shivambu when it dries up will have salt deposits and other stuff and create itchiness and other problems. So we don't want you to have that.
Right. Okay, so you have given a fair idea about how to use Shivambu externally with skin, ear, nose, mouth, and the sexual and anus region. So I want to ask the general guidelines for practicing Shivambu, like those who are not being a patient or just anything, just general guidelines.
Okay. Yeah, I can give you some. For anyone suffering from a condition and would like proper advice, please contact us on Health Siren. We have tried to make this topic as convenient and as easy as possible. Feel free to use that advice and utilize it. But if you run into any doubts or if you have got questions, better to seek advice. So some of this advice can be provided over the phone or the internet. Some cases may require a personal face-to-face consultation as well. Ensure you always have someone who is knowledgeable and can guide your Shivambu journey for best results. If any doubts exist, you can connect with us anytime. Happy, healthy Shivambu use. Thank you.
Thank you. This is a very great opportunity to learn more things about the Shivambu, because most of the time people started using Shivambu, but due to the lack of information and the misunderstanding of Shivambu, they just left the Shivambu practicing.
Correct.
So this will give them a fair bit idea about what effects, initial effects, how to use it, and what are the observations to be done while practicing Shivambu over the period of a week, month, or fair bit year. So that will help us to get practice Shivambu, and that's a very good session on Shivambu. I'm really thankful to you, so that guiding the people all along the world for this Shivambu practice. Thank you, Mr. Bapat. Thank you.
You're welcome. Thank you very much.